Hi, welcome. My name's Shelley Hales. I'm a qualified psychologist. I've had experience working in public mental health with teens. I've also spent the last 10 years working in a school setting, so both primary and secondary schooling. Uh, Early intervention and being proactive is something that I'm really passionate about. So I just wanted to firstly thank Bree Dixon for inviting me to be part of this great presentation series that the Surf Coast Shire is putting on. So here goes. Welcome to my presentation. When should I be worried about my teen and what can I do? I wanted to start the presentation just by bringing your attention to some recent statistics. So I've taken these from the Beyond Blue website. 1 in 7 young people, so aged 14 to 17 years, experience a mental health condition in any given year. 1 in 10 young people, aged between 12 and 17, will self-harm. 1 in 13 will seriously consider a suicide attempt, and 1 in 40 will attempt suicide. Okay, now they're pretty alarming statistics when we look at those numbers, and that risk increases significantly if you're a member of any of those listed groups. So if you're an Indigenous Australian, LGBTI, or male. Okay, now that paints a pretty grim picture. And I suppose I wanted to do something to flip those statistics on their head a little bit. So that statistic of 1 in 10 people self-harming, that also lets us know that 90% of our young people don't self-harm. And I think that's really important to bring our attention to, that some young people are doing okay. What a year 2020 has been. We have coped with a pandemic. Our students here at the high school have coped with online learning, remote learning, back to on-site learning, back to remote learning, and then back again. And so many of our students have coped well, okay? They might not have done everything that they might have done, but they have coped. Some, dare I say, have actually thrived in that environment of doing remote learning. So I just wanted to put that positive spin on those statistics, because sometimes we can get a bit caught up in the numbers. I suppose the statistics that are of concern, again, just taken from the Beyond Blue website, are that half of all mental health conditions we experience at some point in our lives will have started by the age of 14 years. Okay, that number increases to 75% when you get to 25 years. So this is the time that mental health concerns are going to rear their ugly head. But most concerning is the next statistic, that young people are the least likely age group to seek help. Okay, and that in particular are young male. Okay, so thinking about that, I wanted to put a few things in here that all parents can do just to give their young people the best chance. So something that I think is really important is just at home talking about emotions and modelling healthy coping. Okay, let your young person know, you know what, I feel stressed, so I'm actually going to go for a walk down the beach. You know, when they see that it's normal to have these emotions, it's normal to feel stressed or anxious, but there's also a healthy way to cope with it. You know, let them know when you're not coping and that you think, oh my gosh, I need to seek help for this. Let them see that. The best way that young people learn is through modelling. But the third point down, let them be kids. Don't tell them everything. Through my years of working in schools, I've heard a lot of stories from students about families and their financial stress, students who don't eat or bring food to school because they don't want to stress their family because dad's about to lose his job and they've got no money. These are kids, they're young people, they don't need to have the weight of the world on their shoulders. So sometimes it's okay not to tell them everything. Kind of relates a little bit to my next point about being a parent and not a friend. I come across a lot of families over the years who say, my child is my best friend. No, they're not. And I don't mean any disrespect by that. It's really great to have a great relationship with your child, but they're not your best friend. Okay, best friends are for talking about with relationship stress, money stress, any big drama you have going on in your life. As a parent, you go to your friend. As a child, you also go to your friend. I know, growing up as a teen, I didn't tell my parents everything. They didn't tell me everything, okay? What our young people need is a parent and not a friend. I would hope that all of our young children in the community have a friend their own age at school. The next one, be present. And this can be really hard, in times when parents are working. Obviously now a lot of people are still working from home, but it's really important to have family time. And, a good way to do that is to have meal times, have some designated rules. During our dinner, we are not going to have devices. We're not having phones, we're not having the TV on, and we're not having books at the table. This is our time to be a family and to talk about our day. It's a great opportunity to get conversations going about what young person's favourite thing about the day. Also, if there's something that worried them during the day, something they learned during the day. It's a really nice environment to have that. And it'll become a routine. I think it's something that earlier you put that in place, the better. There might be a bit of resistance from some of the teens who are used to maybe, eating dinner in front of the TV, but it's a really nice family time. Let them know that you're there, okay? Let your young people know that they can tell you anything, and that if you don't know how to respond, you will find out. You will find out who can help them with that problem. Talking about young people not wanting to maybe tell their parents everything, it's a really great idea to encourage those relationships with other supportive adults that they have in their lives. It might be a sporting coach, it might be an aunt or an uncle or a grandparent, or it might even be just one of the teachers at the school who they've got a nice connection with. It's really important to have that knowledge that they've got someone else that they will go to. I know when I was growing up, I was very sporty, and often my sporting coaches were people that I would confide in if I needed an extra support. You might have heard of the building blocks of mental health and wellbeing. I know Michael Carr-Gregg, a well-known psychologist, likes to refer to sleep, dietary intake, and exercise as being the building blocks. If you can get these three things right for your young people, you've got half the battle won. Okay, we all know sleep, dietary intake, and exercise are related very highly with mood, energy, motivation, and concentration. So they're also the things that we can control. During remote learning, I had a lot of phone conversations with students from the school, and these are the things that we could set goals around. These are things that we could get back on track, and then the students notice some improvements in their mood, okay? Sleep, a little bit harder to control, but there's definitely things you can do to get your sleep back on track, like having a good sleep-wake cycle, limiting device use before bed, limiting caffeine, particularly in the afternoons, doing something relaxing before bed rather than something stimulating. So these are definitely things that we can set some goals around and control, and they're also things that we know help our mood and overall functioning. So what's normal? What does normal teen behaviour look like? I've put a few pictures there that I think, maybe demonstrate normal teen behaviour. Headphones on. Yep, pretty common with our young people. They love their music. Faces in phones. Yep. Devices are everything. Connection with friends online is everything. Groups of friends. Yes, friends are everything in our teen years. I think we're more inclined to be spending time with our friends when we're teens than our families. And the messy room, definitely typical teen behaviour, okay? Probably also typical teen behaviour. You ask a question, did you have a good day? Yep. What did you do? Not much, okay? Probably pretty normal teen behaviour as well. Open questions are the key there. Tell me something you did today, or what was your favourite thing about the day? More likely to get more response than a closed question. Probably also teen behaviour, normal teen behaviour might be that range of moods, that roller coaster, particularly at the moment when we've been going through coronavirus. Some of you might have heard of the term corona coaster, and I know myself, I definitely had ups and downs over this year. Okay, that's probably pretty normal teen behaviour as well. But what isn't normal is feeling sad, irritable, and anxious most of the time. That isn't normal. Okay, when we're thinking about what's normal too, it's probably really important, as I said, to look at the context. So coronavirus, yep, we're maybe going to be a bit more up and down than what we would be in other times. Those with students in year 11, year 12 coming up to exams, it's normal to feel anxious and worry about your exams and your performance in those. It's also normal to feel sad when you lose someone or a friend moves away. So it's really important to consider that context around the feeling, and also ask yourself, how would I respond in that situation, or how would other people respond? Sometimes mental health concerns can be triggered from a situational crisis. So, it might have been, it looks pretty normal, not coping with coronavirus, but then it can develop into a mental health concern. So I've put in some slides just explaining what to look for. You'll see at the top that I've highlighted a change. That is the biggest thing, a change in how they usually present and function. Changes can kind of go both ways. So the changes in eating or their weight, some people in times of stress or lowered mood don't eat at all, and they're going to have weight loss. Some people overeat and there's going to be weight gain. So there's this extremes on that one. Changes in sleep, exactly the same. Some people will sleep more, some people will sleep less. but the key word there is change. A loss of interest in things they used to enjoy. If you've got a son who's very into football, goes and kicks the footy with his mates every day, lives for footy training and games, and then all of a sudden for 2 weeks doesn't go, won't tell you why, that's an alarm bell. Okay, that's a change in something they've always enjoyed. Withdrawing from friends, as we know, friends are everything with teens. Feeling tired, grumpy, irritable most of the time, trouble concentrating, forgetful, easily distracted, unexplained aches and pains. Okay, they're all things that we can see happening when young people are going through mental health concerns. Okay, when do you get help? Here's 3 questions that can be really useful for knowing when to actually get help. Have you noticed a change in how they feel and behave? Has this change been going on for more than 2 weeks? And impact. Is this change significantly affecting their life, school, work, relationships? Okay, I think that would raise enough alarm bells that you'd be thinking, you know what, we need to get some help. What to do when you're concerned about your child? Okay, the most important thing is to have a conversation, get that communication open. I've just got a great resource here that's from the Beyond Blue website regarding starting the conversation. Okay, I'm just going to play that for you.
If you're honest with yourself and you're actually watching what's going on with your teenagers, you know that you need to do something. So it's just taking that leap of faith to actually be brave enough to do it.
You just got to pick the right time to have that conversation.
I can't do this when I've just rushed home from work or trying to make tea or all the 50,000 other things you do every day. It needs to be when I go in and talk to her that I can just stay there.
Be natural, and whatever comes out is okay. I would actually ask, hey, I've noticed that, you don't seem as bright or bubbly.
You're not behaving the way you normally behave.
You're not sleeping as well. Is everything okay?
Then leave a little bit of a pause. They may well start to talk and open up.
And of course you get the instant, no, nothing's wrong.
Don't give up at the first rejection. Because there might be more there, that it's only one more little feeler away and they'll say something else.
You've got to have a go. And if you muck it up a bit, then the next day you say, you know how I tried to broach that topic with you yesterday? I don't think it went real well. Can we try again? Ask the question to open up the conversation and then shut up.
You're not judging. You're not coming out with statements that are going to make them go, oh, I'm going to close down now. Really acknowledging those feelings and not just saying, oh, well, you shouldn't be feeling like that.
I think she talked for about 2.5 hours in the end. I just waited till she finished saying all the things she wanted to say.
Empathising with them. I hear what you're saying is that you're really going through a really tough time. Answering using her words so that she knows that you're hearing her.
Rather than spitting out the next solution that you've conjured up while you're thinking about it while they're talking to you.
If she stopped talking, I'd just sort of say, well, how did you feel about that? Reassure her to keep on going when she was talking about things that were difficult.
And just that gentle touch was, yeah, Mum's here. Mum's here. She wants to listen to me.
I just offered to support her whichever way she wanted.
It's being there but not being in their face all the time is probably it. Really making sure that you're not picking on the small things at them, sort of giving them a little bit of slack. I mean, not saying that you just let them get away with everything, but if their socks aren't in the wash, or it's picking your battles. He will, even send out a text message, hey, just thinking about you. Just making sure you're okay. Also explaining that everybody at times has trouble dealing with their emotions, and at certain times those emotions can get too much for us to deal with on our own.
Then actively saying, here's a terrific website that I think you'll find really useful. Why don't you go onto that in your own time?
The thing that we found the most helpful was actually getting someone to see her.
If we can't help you, someone can, but whatever, we're going to get through it together.
I said we would like to make a suggestion that you see a counsellor.
I suggested her GP first.
They're not going through it alone. Everybody's there to help, whether it be the parents, the family, their friends, and the professionals that they're seeing. We're all the team behind them.
It's persevering, and just keep reinforcing that I'm here for you. I want to listen. I want to help you.
Okay, so just to summarise some of the key points there is just to make sure that you're having the conversation. Ask the question, give them time to respond and let you know what's going on for them. If you hit a stone wall, keep trying, persevere, letting them know you're there, and just that offer of professional support if it's needed. Okay, I often get asked about suicide and self-harm and how to ask the question of young people. It's definitely always better to ask the question. A myth around self-harm and suicide is if I ask the question and they weren't having thoughts, am I going to put that idea in their head? No, you're not, okay? Asking the question does not increase their risk. And what we actually find is that young people actually feel relief that someone has finally asked them that. And then they're happy to tell you about their thoughts that they're experiencing. Sometimes I'll have people say, no, I'll never feel like that. Okay, and they're not upset that you've asked, and that actually gives a really nice opportunity for you to say, if you ever did feel like that, please come and talk to me, or know who you can talk to. Okay, so how do you ask that question? And that can be a difficult thing to do. So I've just put a couple of just ways that you could word it. Okay, so the first one, I know when some people feel really down, they sometimes feel like life isn't worth living. Is that something you've been thinking about lately? Okay, so that kind of normalizes. Sometimes people feel like that. It's not weird for you to feel like that. And directly asking, is that something you've been thinking about? With suicide and self-harm, the key is to be direct. If you ask a question that's a little bit vague, like, do you wish you weren't here? They might say, yes, I wish I wasn't at school. Or I wish I didn't live where I live. Okay, so you've got to be really direct when you ask the question. Another example might be sometimes people have thoughts about self-harm or hurting themselves when they feel really sad. Have you had any thoughts like that? So I suppose keep asking the question. Your young people are going to feel relief if they do have thoughts like that, to be able to, at last be able to talk about it. Where do you get support? Okay. Obviously, if there's any acute or immediate risk to somebody's safety, it's different to if there isn't. Okay. If there's any immediate safety concerns, 000, always an option. Barwon Health Emergency Department, they have a mental health team there that will triage people through the emergency department, or their access number, which I've included there, but it's 1300 094 187. Okay. If you ring that number during office hours, you will actually get a youth clinician. Okay. So you can talk to them about your young person. Out of hours, you'll get someone from the adult team, but it's still the right option if you've got immediate concerns for someone's safety. Okay. If there isn't an immediate risk to their safety, a good first step for accessing support is a GP. Okay, GPs can screen for mental health symptoms, and they're also really good for monitoring. Okay, they might want to see you again in another week's time or 2 weeks' time. Sorry about that. My slides have accidentally gone one ahead. So they're really good to have involved in any concerns about mental health, but also that first step. They will also let you know what your options are with regards to counselling. Okay, another good first step can be Headspace as well. We've got Headspace in Geelong. You can contact them via phone or online. Okay, you might see that MHCP, Mental Health Care Plan. Okay, what is a mental health care plan? Okay, so it's a Medicare initiative which allows up to 20 sessions per year with a mental health professional. Okay, often you'll hear about it in terms of seeing a psychologist, but it can also be another mental health practitioner, such as an OT or a social worker. They usually do the plans in 6 sessions at a time, and then you go back to your GP for an extension of that referral. And they've recently upped the amount of sessions to 20 in a calendar year. Okay. Different professionals will have their own fees. Okay. If the counsellor or psychologist bulks bills, then you will not be out of pocket at all. A lot do have a gap, so that's worth exploring with the different counselling options. And a really good, if you want to know anything more about a mental health care plan, GP are a great source of information. Okay, another question I get asked a lot is, how do I find the right counsellor? Again, I think talking to your GP is a really good first step. GPs will often know, particularly at clinics where they actually have some counsellors on site, who is a good match for your young person, but also, often I know private psychologists will go in and or send in information about their own practices, new practices popping up in the area, things like that. So GPs can be a good source of information of who to see. Another one is just a good old-fashioned Google search. What you can do is put in, when you do your Google search, look on their pages. You can see pictures of the counsellors usually, but also you can see if they have any specific areas that they work in. So, if you're looking for a young person, I'd definitely make sure that you're getting a counsellor who has experience working with young people. And also if there's a particular mental health condition, general issues like depression and anxiety, most counsellors would be fine for, but, specific things like eating disorders or trauma, it's really good to get someone who's got, specialised experience in those areas. I think getting somebody who works with young people is really important. It's, we often hear back from young people, oh, we went to see someone, but we didn't connect with them. And with young people, that relationship and that connection is really important. They make a decision like that, whether they want to talk to someone or not. It's pretty hard to change that. So, making sure you get someone who's going to be able to kind of break through to your young person pretty quickly is important. Word of mouth is always a good option too. You might talk to a friend whose child's also seen a psychologist and see if they have a name of someone who might be a good fit for your child. Something that happens a lot, and particularly at the moment with the pandemic, there is a long wait list to get into private supports. Okay. Really important to get to your GP. Your GP can make regular appointments to monitor your young person, but also once you've got that mental health care plan, you can get on a wait list. Sometimes the wait won't be as long as what you're initially told. In the meantime, it can feel like, oh, we've got no support. We've got to wait 3 months to get into this psychologist. Okay, there's definitely things that you can do to be helping your young person in that short term. There's helplines, Kids Helpline, Beyond Blue, Lifeline. Okay, just to name a few. There's online and self-help resources. Headspace have actually got e-Headspace where you can receive counselling via web chat or email. Okay, so there's definitely resources out there. You can also look up, there's one called the Black Dog Institute, which have modules that you can work through. Okay, they all have information and some self-help resources online. Definitely contact your young person's school. There will be a wellbeing coordinator. A lot of the local high schools now have someone like myself who's employed in the capacity of a mental health practitioner who can provide some short-term counselling while waiting to link in with external support. And Barwon Health is crisis support for everybody in the community. Okay, you can call that access number at any time. It's a 24/7 number. So anytime you need crisis support, Barwon Health are the person to call. You can also call them for advice or let them know, we're struggling, we're waiting to get that support. Is there anywhere else we can turn, or is there anything else we should be doing? Okay, there's a lot of resources there and also online that we can be accessing. As I mentioned, before, the Headspace, Kids Helpline, Beyond Blue, great resources that anyone can access at any time. We find some young people find it really helpful to do the e-Headspace and just talk sometimes to the same person, sometimes to a different person, but online they find that less intimidating perhaps than the phone. Definitely check out those resources. Thank you very much for your time. So obviously there's a question and answer session scheduled in for the 17th of November. If there's something in particular that you really want covered, please do email in to Brianna at the Surf Coast Shire and she will forward your questions on to me, and I'll do my best to be able to answer them in that session for you. Thank you very much for your time. I hope even just one thing has been valuable from today's presentation. Thank you.